Ladies and gentlemen, dear colleagues, good morning, good afternoon. It is really a pleasure to welcome you to the launch of the book on revisiting targeting in social assistance. This is a task that is monumental at any point in time, and it is perhaps even more difficult and complex at times at which we live, where shocks we experience, both natural shocks, health shocks, man-made shocks, make rapid shifts in the way many of us perceive how we prioritize social assistance, who should get it first, who should wait longer, what is the right approach to the challenges of targeting. Targeting has always been fraught with conceptual difficulties and practical difficulties. And there have always been many criteria by which either the success of targeting or the lack of thereof can be gauged. So the debate has always been very lively. The dilemmas were huge, and the issues remain pertinent. And even more pertinent at times at which we live. I am very proud of the authors of the book for assembling in this publication a lot of materials, bringing them together and trying to make important policy conclusions. This work was advanced prior to the COVID-19 pandemic, but I am very happy that the authors were able to include lessons from the pandemic as well. So it really brings together the topic of targeting in general, but also the crisis response in particular, which is compared to the main existing literature, a big step forward. I think that in a way of giving you a sneak preview, there are some particular parts of the book that I find really exciting. The role of delivery systems of social protection, delving into topics such as the definition of the assistance units, individual, nuclear family, extended household, or others. The role of big data and artificial intelligence, integration of thinking about human rights into the analysis. These things are novel and extremely important. At the same time, I find the book richly referenced. There are hundreds of citations in the reference list, so it might be extremely useful to those who would like to delve further into the topic. There are also examples cited from more than 100 countries. One of the challenges of the wise treatment of targeting is the fact that it needs both to consider global lessons, but also have a deep country knowledge. So from that perspective, I am extremely happy that we assembled today such a stellar panel to discuss the book during the launch. I will introduce the panelists after the main presentation. And for the main presentation, not surprisingly, we go to the main author of the book, to Margaret Grosh, our senior advisor for the social protection and jobs global practice. And as I said, one of the authors. We will ask Margaret for 11-12 minutes presentation of the main findings of the book, after which we shift to the panel, which I will have an honor to moderate. And at this point, I will also introduce our panelists. So without further ado, let me pass the floor to Margaret Grosh.
Good morning. It's a pleasure to be with you today to show this book, which I seem to be doing out of order. I have lost control of the ability, there we go, to control my screen. Sorry. Okay, it's a pleasure to be here with you today to share this book with the social assistance community. I want to recognize that I'm part of a whole team of authors. I represent them all, and there are many acknowledgements due to many who have helped us along the way. So we have only a few minutes. We have a book that we as authors like to use words like rich, multifaceted, comprehensive, detailed, nuanced, whatever. Even in our humble moments, we have to use the adjective of long. So what I hope to do is give you just a little sampling of a few of the key messages, but more of a taste of the kind of information we present and how we present it. So we start with this conceptual framework from policy objectives to impacts. And we do that because we find that discussions about targeting are important all the way through the chain, and the whole chain is important to the details of targeting. Without understanding that, we see many debates that can be hot, sometimes even vicious, but they're kind of missing a framing that then misses some of the solutions to how to make things better. So we really think it's important to have that whole picture in mind. In the book, we talk about many of the aspects of targeting. So we start with the question of whether, why, when one would even wish to target a social protection program, and if so, to how narrowly or broadly. So we review the potential benefits, the kinds of costs, some estimates of the empirics of those costs, and of the targeting errors that are likely to occur. So that whole question of whether to target is in chapters 1 and 2. The question of what targeting method to use is treated in full in chapter 5 with a whole panoply of methods. But even after those two questions are answered, there are a host of subsidiary questions that have to be addressed about the details of the targeting method and how to apply it in a particular country context. So those get the bulk of chapters 3, 4, 6, and 8. And throughout, as Michal said, there's different metrics, and those metrics actually speak to different values. And so that topic recurs throughout the book, but the technical details of the metrics are in chapter 7. So we have all of that. And I would say that through much of the book and through many of the topics of targeting, there's not a single right answer, a yes and no, a clear decision tree. Rather, there's a host of trade-offs. There's areas, many gray areas. There's decisions about whether to move a little further along a gradient, one direction or another, and the costs that might be incurred if that were to happen. So we didn't write a recipe. If I had to stick with a culinary analogy, I'd say we wrote a guide to cooking techniques and menu selection or something like that. The first of the topics on which we are not definitive is whether or not to target, how narrowly or broadly. A host of decisions will be made by different countries, but we do note that somewhere every country targets something. So that's why it's important to understand. When it comes to the choice of methods, there's no method that is always preferable in every circumstance. We really have to make those choices based on the purpose of a program, fit the method to the purpose and to the context. I'll give a couple of examples. Geographic targeting, we all understand what it is, the data already available, it's simple to understand, explain, and do. It may fit very well if the purpose of the program is to assist those who have been hit by some sort of geographically delimited natural disaster. So an earthquake, a flood, a hurricane. Geographic targeting is a natural there. It won't assist the rest of the country. It may have a few errors of inclusion of people in the area that weren't so badly affected, but it'll be minor. However, if you try and use geographic targeting for something like chronic poverty more generally, or for the aftermath of the global financial crisis or the post-pandemic recession, there it's going to have much more problematic errors of exclusion because poverty exists everywhere. It may be deeper or more concentrated in some areas, but it does exist everywhere. And if you rule out a whole part of your country because you're focusing on one part, you'll have consequential errors in the other part of the country. So there, how we evaluate geographic targeting depends on the purpose of the program. Context will matter. When we think about means testing, it can be the best direct measure of welfare, a true measure of welfare, and therefore accurate, but it relies on data being observable to the government, which is pretty accessible in Social Security records, in registries of property, land, vehicles, etc., which are very dense and comprehensive in some of the more formal economies, and maybe even for the upper end of the income distribution in mediumly formal economies. So it might work if an eligibility threshold is set more sort of as affluence testing rather than for the very poorest. For very poor people or in poor economies, means testing isn't going to be really very applicable. So then there's other methods. The other factor that comes in often is political economy. The method has to be acceptable to the technocrats and hopefully to the public at large. And we think that's one of the reasons why demographic targeting is actually the most commonly used method. About 2/3 of all the social assistance programs we have data on use demographic targeting either alone or in combination with something else. And that's because for some purposes, it is actually quite fit for the purpose. It is always an imperfect but strong proxy of poverty, and it's usually very politically acceptable. So those are some of the kinds of factors and why the answer will vary from place to place, time to time, program to program. In fact, we see in any given country that there's usually a variety of methods used across the social protection panoply of programs, but often a single program may use multiple methods at the same time. So there's lots of nuance and indeterminacy about choice of method. So we give a fair treatment to that in the book, but because all of the methods are relevant somewhere, we then have a very long chapter on how you do each one. That's too long to get into today, but we do have the panelists addressing some of those questions. Another hot topic in targeting today is the whole area of how tech change is influencing targeting and whether it can raise the game. So we have our traditional government databases, as I mentioned, for means testing. And in order to extend the range of data available, many countries have built social registries with purpose collected data that gives some proxies of poverty, not so much welfare, but proxies of welfare. But whenever you have proxies of welfare, then you need some kind of algorithm, statistics, math, to make inferences about how those proxies actually relate to true welfare. So when we have fairly simple data, as in the social registries, as in the traditional proxies, fairly standard econometric techniques that have been known for years are applicable and have been used. There's been a little bit of elevation of methods from basic ordinary least squares to quantile regressions. But to the degree that we are beginning to get new evidence in on machine learning on that old data, it seems that so far it's not so powerful, that the limitation was in the data, not in the algorithm. Now, where the machine learning really comes in is when we have the new big data, all the stuff that's georeferenceable today, all the satellite imagery that talks about weather and natural disaster and climate. Those things can add new proxies, both to our standard sort of proxy means testing, and they can be materially helpful in planning and responding to disasters. So the early warning systems and the adaptive social protection responses. Detail records are having a bit of a moment at the moment as their potential to proxy welfare is being understood. And there's some really very positive results coming out. But it should be noted that this big data is still proxies. It's not measurement. And so it does need the algorithms, and it still has some statistical error. So some of those judgments about what's acceptable have to be thought about. And we have to think about gathering further information to see how well this will work in what context, and looking at the incentives and the sort of societal acceptability of using these sorts of data in eligibility decisions. It's kind of new, untested ground in a way. But for all of this, we're trying to give kind of a framework because it's so quickly emerging a field that we can't have the definitive answer today, but we wanted to parse out some of the factors to think about so that as new information becomes available, the reader will understand how to integrate it. And we would point out that for all of these things, they're relying more and more on reuse of existing data. And with that, the implications of the need for policy to clearly specify, have informed consent, and adequate data safeguards and protections are really important. So that's a whole new area of policy. The one place in the book where we're really definitive is that delivery systems are key. So we're quite prescriptive on that recommendation. One must work on delivery systems. Even in the simplest targeting methods, there can still be a lot of errors of exclusion if you don't have enough outreach, if the neediest have barriers of distance, language, digital divide, etc. So we really need to worry about the delivery system. The particular way in which it can be improved will vary from country to country. Let me close with a notion of the dynamics of targeting. So at the level of the household, the individual, who's going to be in need is going to change, or how intensely they will be in need will change from week to week and year to year. So we clearly need eligibility decision-making that is dynamic, that can admit people when they need help, and that eventually recycles and recertifies people sometime after. That length of recertification can vary, but some sort of process is advisable. We also think about dynamics at the level of the program or the country as a whole. We see story after story and tell story after story in the book of where a program or a government has looked at what's occurring, been a little critical of it, thought about how to improve it, and then built capacity or changed the rules or harvested new data or data science to improve the situation. So there's lots of opportunities to improve over time in how a particular method is implemented, or even to change methods as a new purpose or context sort of evolves. We've seen a few cases of sort of stagnation and deterioration in results. And so that's just enough to remind us that in targeting, as is everything else in social policy, political will and administrative effort and resources are really strong determinants of the outcomes. So with that, let me close and we'll move to the panelists who can make some of these big ideas kind of more concrete and country specific. Thank you.
Thank you very much, Margaret. And as Margaret said, we move directly to our panelists. Let me very briefly introduce them. We are having with us today Dr. Ousseynou Diop, who is director of Senegal's National Social Registry and the General Delegation for Social Protection and National Solidarity. We also have it with us Mrs. Laura Pabón, who is Deputy Director of the Development National Planning Department in Colombia. And we have Dr. Rema Hanna, who is Jeffrey Cheah Professor at Harvard Kennedy School in the US. Really stellar and diverse panel. And I would like to start, I would like to make two housekeeping points. First, all panelists are expected to respond to in no more than 5 minutes. Second, Dr. Diop is expected to speak French, and those who joined, please use, if you need, the interpretation function. Let me start with Dr. Hanna, please. And as we heard from the presentation, and as we can read in the book, clearly there is no one targeting method that would be preferred in all contexts. Everything depends on the context, country context, as well as policymakers' objectives. Could you tell us, Dr. Hanna, given your own work, about advantages and disadvantages of different methods and why the country context is so important? Dr. Hanna, over to you.
No, thank you so much. And first, I want to say thank you for inviting me. It was, and also not only on the panel today, but also to give me an opportunity to read and comment through the book process. I've learned a lot, and I think it's really wonderful that such a great group of authors, such a great group of practitioners are really taking on the topic and trying to bring together the evidence for the community. And so I really thank you for the job you've done on the book. I think this is the big question that every country is struggling with. How do you actually target? How do you actually find the people who are most vulnerable, most in need, and provide social assistance to them? And as you said, I think there are lots of different methods out there. The methods really matter for both the country that you're working in and the institutions within the country, but also the objectives that you're targeting. So let me give you some examples on this. And as Margaret mentioned, in the end, what ends up happening is that you end up using a variety of different methodologies because different methodologies have strengths and weaknesses, and combining it together for the institutions that and the policy context that you have in place. So let me give you some examples. So for example, first starting to think about the country context. As you've got countries that are more information rich, where there are more workers who are in the formal sector. There's more information available to the policymaker. There's more information available if somebody's income, there's more information in the tax system, there's more information as a paper trail if somebody's lost their job. And therefore, there are multiple different dimensions of information that the policymaker can use to do real-time targeting. But if you have a country that is, workers are very informal sectors, people are relying on different types of subsistence farming and casual work, and there are no paper records. Obviously, these methods that rely on administrative records, on formal levels of income are not going to work for those countries. And then you start to get into other different types of methodologies. Can you, for example, use self-identification methodologies where somebody can come in and self-identify as needing assistance, and there is verification methods? Well, that is great in theory, but if you don't have the institutions in place in rural areas where people can actually come in and apply this, in practice, you're going to miss many of the vulnerable. And so thinking about what sort of institutions you have in place, thinking about the market conditions, I think are really, really important. I'm going to comment on one other thing and then I'll turn it back. But the other thing is really about the kind of objective you have in targeting. So some methodologies are very good at getting at the systematic core. So a lot of these data-driven approaches where you're collecting data on assets, typically we call them proxy mean tests, are getting at whether I've been systematically poor, whether I have fewer assets, and whether I might need long-term transfers. But it's not going to really get at, well, maybe I have a house, but I've lost my job today, or the main income earner in the family has passed away. And so a lot of other different types of methodologies, either using some of these big data techniques or using softer information such as community targeting, self-identification, or methodologies that might help us be a little bit more responsive to these kind of shocks. In the end, every methodology has its strengths and weakness, and I really do think this is why, for most policymakers, is trying to use a combination of techniques to make sure that even if somebody is missed by one technique, there are safeguards in place to help bring in information and really try to find the most vulnerable. Thank you.
Thank you very, very much. Very convincing set of issues why the country context matters. Let me now move to Dr. Diop, please, and let me move the topic from targeting to actually implementation and monitoring, because even if the targeting method does not change, the implementation arrangements, the monitoring arrangements may be in need of change. And Senegal gives us a very, very interesting and important example, because Senegal has been working for a number of years now to implement a single national registry system that combines geographic, community-based targeting as well as proxy means testing in order to determine the eligibility for social programs, as for instance, the National Cash Transfers Program. And Dr. Diop, could you tell us about Senegal's social registry system, and especially about how that system and how the implementation of that system has been evolving to better serve social protection for both chronic poverty and social protection that would be shock responsive and adaptive? I know Senegal offers fantastic examples of that. So over to you, Dr. Diop, please.
Okay. Merci, monsieur le modérateur.
Thank you. And good morning to all of you. As it has been said, since 2014, 2005, Senegal developed a national registry which is focused on poverty. With the new paradigms, we have the adaptive social security and the adaptation to catastrophes. Then we had the pandemic of COVID-19. And after all these crises, we have tried to broaden the spectrum of our actions. The first thing we did, we asked to all the sectors to have partners with them working for these people that are in situation of vulnerability or of poverty, and we asked them to take into consideration the different variables and to send them a questionnaire and to understand if there are special concerns. This allowed us to implement adaptive social security, especially for people that are in a state of urgency, of emergency, and especially chronic poverty households. We could combine these variables in our system. We have collected a lot of data, and especially for these people that are in a special situation of shock. And these were the basis for our actions. This allowed us to improve our procedures. We have an handbook with all the different systems. I'm sorry, the connection of the speaker is not very good sometimes, but currently Senegal is going to improve all of the situation of many households. And in 2022, we're going to improve the situation of many households, and we're going to get to less than 25% of households in our country. We're going to provide a lot of information to them. But what allowed us to carry out this work is the fact that thanks to the support of the World Bank, in the framework of a specific program that we have developed with them, we have developed a pilot project that is aimed at targeting households that are in situations of vulnerability, that are in situations of shock. And we also have pilot projects for agricultural households. In 2-3 years, we developed a number of data that are feeding our reflection and are allowing us to broaden our scope of action. And from 29% of households that we were helping in our country, we got to 55% of households today. We're working also on the categorization of these households. We worked on the profiling of our households. And this, thanks to the help of the World Bank, I'm sorry, the sound goes on and off. And so we implemented the adaptive social protection. This makes it possible for us to strengthen our targeting, to strengthen, to improve our efficacy, our accuracy, because we try to affect our resources to eligible households, thanks to a coordination effort. The sound is totally gone now. I think it's frozen. Sorry, the interpreter apologizes, but the speaker apparently has lost the connection.
Aux préoccupations, aux besoins réalisés, tout le processus de collecte, de manipulation et de partage des données. Donc globalement, c'est en résumé.
At the global level, in summary, we are working for the construction of this social protection system. Thank you.
Merci beaucoup, Dr. Diop. Thank you very, very much. I think by now we actually covered quite well the issues of targeting as well as the issues of implementation and monitoring. And I would like now to move on to another, I would say, pillar of modern targeting system with respect to both policymaking and implementation, and this is the issue of social registry. It is a fascinating discussion because we very often cite countries that have social registries working well as examples for others. At the same time, there are many countries, including the highly developed countries, that they do not have social registries. They have rich databases, but they don't always speak to each other, and they cover different parts of the population. And Colombia is a very interesting example, precisely because it was one of the first countries to develop social registry and then to use it for supporting eligibility for multiple programs. So Colombia's CISBEN has been an example for many, and also policy directions seem to be very clear, coming from the federal level with very clear administrative role for municipalities. I'm going to go to you, Deputy Director Pabón, with a particular question related to the updates, changes that you have been doing with each update of CISBEN, both changes in statistical methods and how you customize those changes to the region. I learned that the most recent update includes new data and new algorithms based on machine learning. So it would be very interesting to hear from you, Director Pabón, how Colombia's adjustments from more basic to more sophisticated methods of estimating welfare helped in improving social protection outcomes in Colombia. Over to you, Deputy Director Pabón.
Thank you. Thank you so much, Michal, and good morning, everyone. It is a real pleasure to be here. Let me just start by saying that we have a long history with the CISBEN, which is our targeting instrument, our system for identifying potential beneficiary of social program. CISBEN was first introduced in 1995, and since then it has been updated 4 times. This last version of CISBEN, CISBEN 4, which was introduced last year in 2021, includes significant improvements on the methodology for estimating welfare on the whole operational process, on the data collection process and consolidation and the visualization of the information. So we have better quality information. On the previous version of CISBEN, CISBEN 3, the algorithm used to approach household welfare did not adequately capture household ability to generate income. So the new targeting methodology, CISBEN 4, captures income and living condition of households. We want the new CISBEN to be able to better approach households' ability to generate income. And this is an important change from the previous methodology, and it was on incorporating the productive and the income dimension into our PMT. The methodology of CISBEN 4 also takes into consideration the existing variability differences or disparities within the country. And we have several models for each province and for urban and rural area. And we have also introduced some machine learning techniques into our algorithm, and all that allowed us to improve the accuracy of our model. And based on the new estimation of household welfare, households are then classified into 4 groups: extreme poor, poverty, vulnerable, and non-poor households. And these groups or classifications are more aligned with our official poverty measures, which is important to have some correspondence between our targeting instrument and the official numbers. And it is also important to mention that for the first time, we have information to identify not only households that are poor, but also those households who are above the poverty line, but are vulnerable, households who might also be eligible for some benefits and to also be the focus of some policies and interventions. So Overall, the new model, the new PMT, significantly reduced the errors of inclusion and exclusions that we had on the previous version of SysBEM. SysBEM 4 also included important innovations on the data collection process. We moved from paper-based service to data collected using mobile devices. So we have less errors of the information provided. We are now able to get individual identification information, ID numbers, names by scanning the barcodes of the identification document. And this is an important information and exclusion for programs. It's also for payment. So in another new thing, innovation that we have is that for the first time we have geolocation information of households, the GPS coordinates of households, information that it is also important for geographic targeting and also to increase the effectiveness of the allocation of social services. So to wrap up, we have better information that reflects households' ability to generate income. Inclusion and exclusions errors were significantly reduced. The new classification, the one that is used by programs to identify their own beneficiary, it's more accurate. We also have improved our operational processes. So there is less time since a survey is requested and the information is published. And this is something that is highly valued by households. So I will stop here. Thank you.
Thank you. Thank you very much. A very convincing example of the major role social registries can play in improving the targeting outcomes. I would like us to reflect a bit more on the issues of technology, big data and new technology. And I would like to go first to Dr. Hanna on that. This technology issue is fascinating because most of us, I think it's fair to say, are fascinated by endless possibilities that big data and new technology offer. On the other hand, we do have colleagues, including your colleague at the Kennedy School, Lant Pritchett, who would always tell us, you know, technology fascinates people for no good reason, because the problems remain the same, and however good the technology is, it doesn't change the fundamental issues in social policy making or economic policy making. Maybe Lant is a bit of an extreme case, but still very valid voice on the scene. So I would like to ask you, Dr. Hanna, staying with the role of big data and technology, what are your thoughts on the role of new technology, not generally, but specifically in improving targeting and social protection systems performance, looking at it from a global perspective? Dr. Hanna, over to you.
No, thank you. No, this is such a big question. I'm gonna, Margaret really summarized also where I stand on the idea of big data and machine learning, that there's some promise with machine learning that it can help improve things, but it's not really going to be transformational. But the gains from big data are really from better administrative data, early warning systems. So I'm going to put that aside since she really summarized it well and focus on the technology question, which in itself is a very large question. I do think, technology can help us improve targeting and delivery of social protection programs. But of course, I also agree with Lant that it really depends on how you design them. It depends on whether or not they're user friendly. And we need to really think seriously about data protection. So I'm going to start with some examples of where I think technology can really help. And particularly some examples from my own research. And then I'll talk about those issues of where, the worries we also have with technology and what we need to be thinking about to make it most useful. So I want to focus on 4 different issues. The first issue where I think technology can really help is ID systems. Oftentimes we set up ID systems in countries and there haven't been very good real-time mechanisms to update them. And so, for example, in some of my own work, what we've seen is people wanting to sign up for the benefits that they're eligible for, but their underlying ID cards and their family ID cards are not correct. They haven't been updated in the system and they get locked out of the system. And so one way I think technology can help is by having more flexible and dynamic ID systems. The second way I think technology can help is bringing down the cost and improving the quality of the data. So one big challenge we have in targeting is that the targeting is only as good as the data that we bring in. And here's where technology can help. We've moved from paper surveys to electronic surveys. You could do recordings in the field to make sure and monitor that you're actually getting the right people. The full survey is being done, as opposed to these very costly ways we were doing back checks before. We could have better updating. We can see the first day of surveys and really quickly change our instruments based on if we see problems in the data collection in ways we couldn't really do before. And so the second way, I really think it can improve our data quality. The third way I think technology can be used is improving self-selection techniques. And we really saw this during the pandemic. It's a real challenge for people to be able to come in. There's a cost to have to, travel to maybe from a rural area to a district center to come in and say you want to qualify for benefits. And nowadays, through technology, we could provide information to households about what they're eligible for, but also improve the ability to self-identify. And as I said, in the pandemic, we really saw this when several countries, for example, Pakistan was one of them, where they set up text messaging type systems and call-in systems that allowed you to apply for social benefits in a way that we haven't been able to allow people to apply before. And then the fourth way where I feel like it could improve the targeting is through the distribution methods. And so, for example, in some of my own research, we evaluated Indonesia's large-scale reform from in-kind benefits, where just food was given out, mostly rice was given out, to an electronic debit card in which people can access and buy rice at private markets that have the systems for the debit cards. And what we really saw was that by moving from the in-kind, where many people who are not eligible just actually access the program, to moving to the debit cards, it really concentrated the benefits to those who are actually eligible, who are also poor. And what we found is that those then who are actually eligible received a lot more of their subsidy, and we saw poverty reduced for these groups. And so it can actually, the technology can help us not only improve the targeting, but improve the fidelity of the targeting in the implementation process. Now, again, these are some good examples of where technology can be useful, but I also agree with that. I've seen many cases where the technology is set up to be so complex that it's not actually very user-friendly. The technology has to be very different in a country, such as Colombia and Chile versus which is fairly richer on the income distribution than countries such as like Togo or Malawi, where where people tend to not have access to the same kind of technology systems, particularly the people that you want to reach the most vulnerable. So again, the technology really has to be designed to the institutions of the country and the access people have. The other aspect of this that I also think is really important is issues of data security. We've seen countries that have used data for not great purposes. We've seen data leaks in place. And I really do think that if we want people to have trust in the system, trust that their data is being used for good purposes, because as Margaret pointed out, transparency in the system, the politics, the political economy around this is so important that if we want to use this data, we have a responsibility to really make sure that the proper data security protocols are put into place. And I think that's something where I think is really important for us to be thinking a lot more of as we start moving to these more intricate data systems. Thank you.
Thank you very much. I would like now to move to Dr. Diop again. I should have started probably by congratulating Dr. Diop on Senegal's qualification to the World Cup in football, but I decided not to do it because Colombia hasn't qualified, and we have also Director Pabón with us. So, but now seeing you, I thought it's a good time to do that. But I don't want you, Dr. Diop, to talk about football. I would like you to talk about something which has always been a big issue in targeting and in social protection generally, which is how to include groups that are, we even say sometimes, traditionally excluded, as if it was a tradition, but it is not really traditional, it's persistent. It's hard to get to certain remote areas. It is hard to get to people who have been displaced internationally internally or internationally. So I would like to ask you how the social protection program at your General Delegation for Social Protection and National Solidarity supported targeting and inclusion of those excluded groups, such as displaced people, such as those who live in remote areas. Over to you, Dr. Diop. You remain muted, so please unmute yourself.
Okay, merci, Monsieur le Modérateur.
Thank you very much, the moderator. I would also like to thank you for congratulating me on our football team participating to the World Championship. Apologies, but the mic is off again. Okay, there we go. As far as inclusion is concerned, I need to specify one thing. Since the very beginning, the single national register has been developed considering the needs of displaced people too. So we have developed several projects in the framework of our program, and our decision was to collect information in our registry from all countries. So we try to be as inclusive as possible. And we have over 25,000 villages that are involved. All countries, all villages are involved, and data are collected everywhere. So we try to be really inclusive. And we also try to target state services. We have specific programs developed, for example, for disabled people and for other minority groups in our country. In Senegal, we also have a national program for family security. It's a very wide cash transfer program. It is one of the first programs which have been introduced in West Africa. And in fact, all of the programs have the objective to set up our register and collect wide data. So we want to collect data concerning family security and consolidate such data and enlarge such data. So again, we don't want to create an exclusion, and we try to work with partners in order to support this objective. Our partners, for example, target women or children living in difficult situations, in difficult contexts, and such partners have a great experience in targeting. So we also have a supervisory committee in Senegal today. So in each region, we have members of the committee working in collaboration. So it's a very wide and complex work we carried out together. And again, we try to involve partners and to target many people in different areas and regions. So all data coming from 14 regions are centralized in one database. This allows us to prevent possible exclusion. That is why working in such a wide context is very important, but with the collaboration of all stakeholders in the individual areas. This allows everyone to claim their rights. At the moment, the system is not 100% working and effective, but this is our objective, and we try to further develop this system and to improve it. So we also try to collect claims by people, and we have a register, a database of complaints. So we try to analyze each complaint and to set up a system where we have categories of different complaints. In real time, we are aware of the difficulties that people encounter and so on. So, of course, we have different areas in our countries where access to technology may vary. We are also trying to remove all possible barriers because sometimes access to technology is easier. And we are trying also to develop applications and to provide people with tablets. Well, overall, we have about 6,000 members working all over the territory in the communities to spread information, to spread knowledge and access to technology. So, of course, this will take a lot of time, but it's work in progress, and we are trying to reduce possible gaps as much as we can. Thank you.
Thank you very much, Dr. Diop. Let's stay for a while on the issue of excluded groups, and I think Colombia offers very good examples. Those excluded groups are different than in the case of Senegal. I think in Colombia you care a lot about the indigenous population and homeless people. Could you give us a few examples, Director Pabón, of special efforts of the inclusion of those groups from Colombia? Over to you, please.
Yes, thank you. Yes, we have some examples for homeless and for people with disabilities and with migrants. So SISBEN 3 and the previous version of SISBEN, some of the previous ones were designed for people in households, for people living in unfixed households, on fixed residence. So groups living in special places of accommodation, temporary households were excluded from the survey. And this is the case of homeless in Colombia, and this is the case of minors under the protection of the Colombian Institute for Family Welfare or for youth at detention centers. So this is a problem that we were facing with some specific groups. So to address this problem and to give you some examples, we developed a new registry for homeless, a registry that is linked to SISBEN 4, to the new version of SISBEN. So what we did is we provided the technical and the operational guidelines to municipalities for the operation of this new instrument. And I forgot to mention that the operation of SISBEN in Colombia is decentralized, and we work together with municipal and local authorities. So the new information on this new registry for homeless must be collected and reported by municipal authorities, and that information is added to the new centralized data. This not only enables the already existing regional database of homeless people to be unified and constantly updated, but also encourages the correct, modern, and traditionally been excluded. This is the case for homeless, where we have a registry for them. And on the people with disability, it is important to mention that there is a registry, and it's administered by the Ministry of Health. And we are also in the process of integrating this information with SISBEN to have the interoperability with the SISBEN and this registry. And there is also a national policy for people with disability. One of the main strategy of the policies is, of course, on better information. And the National Development Plan created an observatory of social and productive or labor inclusion of people with disability. And the purpose of this observatory is to gather information, to analyze, research, and to monitor how the country is moving forward with the implementation of the policy, and to follow up on the social and labor inclusion of the people with disability. And all the information produced by this observatory, it's expected to be linked with the SISBEN 4. And one last example that I would like to mention, it's on migration. as you probably know, we have granted protection status to almost 1.8 million migrants from Venezuela for 10 years. Many of those migrants lack regular status, which affects the ability of those households to access to a section, to some services, to some protection, to some programs. So the next step for regular migrants is to have access to social, health, labor programs. So we need the CISBEN to be able to integrate information from migrant households. And to do that, we first designed a strategy to reach out migrants. We're working with some migrant communities, with different stakeholders at the regions. So the survey can be administered. And for that, that's why we're working in close collaboration with some municipal authorities, and we're working also with the migration, the border authority in Colombia, who has the contact information of the migrants. And for those migrants who don't have a permanent housing and that are living in shelters or temporary households, or temporary housing, we have designed a new registry to gather that basic information. So having the information on CISBEN of all migrants who are granted temporary protection status is now a priority that we are working on. So this is one example of what we're doing right now on the migrants and the new population and houses that are, or households that are now granted temporary status in Colombia. We have to integrate the information of the migrants into the CISBEN, and this is a challenge that we are facing right now.
Thank you very much. I would like us to make a quick detour to the issue of costs of targeting. But let me just share with you, I'm sure you know that, but there are people out there who declare that they are against targeting, they are enemies of targeting. And once you actually dig deeper, talking to them, you would realize that at the end of the day, they also target, except that they use different adjectives like universal child grants, which is an example of categorical targeting for children, but they would say universal. So they just go for different methods, but on the surface, then they don't like the whole concept. And one of the arguments that is often used by them, which I encounter in my discussions, are targeting costs. They tend to say, oh, those costs are huge, are prohibitive. Because of them, you shouldn't even think of targeting, to caricature it a bit. But I know, Dr. Hanna, you have done very important research, including in this area. So would it be true, what we believe in, that those costs of targeting are often moderate or manageable? What does your research say about the issues of costs? Over to you.
No, this is a really good question. It's something that I thought about for a really long time, because, you know, you look at the price tag of targeting and maybe you see a few $1 million and you're like, this is a lot of money, and why can't we be spending it on giving that money to the poor? And so because of this, I spent some time looking at this and digging into the data. And so, for example, you know, to give a very simple example, suppose you have a fixed budget of benefits you want to give out. You know, while the targeting amount might seem high, it's actually pennies on what you're actually giving out. And so if you didn't do any targeting and you gave the transfer to everybody, you're just adding pennies onto everybody's benefit. But now imagine that you spend some of that money and invest in targeting, and you're able to like lop off the richest 30%. You can actually, or the richest 50%, you can actually double benefits to the poor as opposed to give them a few extra pennies. And I think that's like inherently the question is how much redistribution we want to do, and how much we want to invest in trying to do that redistribution and thinking about the kind of benefits we're giving out and the concentration of benefits to the poorest and most vulnerable households. And so I do think, well, you know, as we said, while the sticker cost might look, you know, high initially, it is actually in practice very small to the benefits you actually gain from targeting and the ability to really help the poor. But I want to note one other thing that we don't talk about as much, is that there might be these other benefits from investing in these kind of systems. So, you know, first of all, you know, oftentimes these targeting systems, not only are they helping us target, In a lot of countries where there's not that much data available on populations, it's actually giving us a lot of information about citizens, particularly the poorest of the poor, about assets, about employment levels, about types of jobs, and that information can also be used to design better policies. And so there's an information benefit from investing in these systems. The second aspect is this aspect I mentioned before of, if in the process that we're strengthening through the targeting and the social registries, we're also strengthening other aspects such as ID systems. This is another benefit as we're trying to help bring people into the state systems. A third one is, as we're starting to do, better targeting, better registries, if we're also connecting it to digital payments, an open question is whether or not by providing these state accounts to the poor, we're actually connecting them to better banking services that would allow them to get more access to finance and more loans if they needed and savings accounts. And so this question of whether or not the system as a whole is also bringing in these other benefits, I think is really important as we're thinking about what this investment actually is. But for me, I want to note one other thing. I really realized how important these systems are and making sure we get these systems right during the COVID crisis. When the government needs to act fast, when there's a shock, suddenly many more people are more vulnerable than before, and you really have to help, and you have to help quickly. If you don't have information at your fingertips, if you don't have a list of the citizens out there, you don't have a list of industries that maybe the citizens are working in that now that are hit. If you don't have information about income levels of who might be the most vulnerable up the income distribution, you can't actually act. And we saw this during the COVID crisis, that countries that had better systems in place were able to respond better to their system, better to their citizens, quicker, and really help them weather the shocks. Whereas a lot of other countries were, struggling to try to set up these systems in place during these really bad times when everything else was going wrong. And so really, I view it as an investment, especially in good times, of trying to help us when things go wrong and things in the bad times. Thank you.
Thank you. Thank you very much, Dr. Hanna. So given the importance of social protection delivery systems, which is so much highlighted in the targeting book, I would like us to end on the reflection on those delivery systems, and especially the reflection on one of the very important elements of the delivery systems, which are social registries. So my two remaining questions to Dr. Diop and Deputy Director Pabón would be related to the registries. And to Dr. Diop, I would like to ask the following question. We know that Senegal has just passed legislation mandating the use of social registry for 30 programs. It seems like a very important step forward in the social protection systems. Is it, Dr. Diop? Could you comment on that and tell us about the importance of this particular decision? Over to you, please.
As you know, Senegal made some investment in this domain. And in the past, our President of the Republic has launched an edit, and with the signatures of all the trade unions of the country. And now we have national programs, and we also have a partnership with our partners. And this is very important. As for this decree, we know that there are both advantages, but also many challenges. We have a national committee that has been set up, which is responsible for piloting all the development processes, the updates and the meetings, etc. This is important. because this is a work that has to be done by experts, but we have all the sectorial ministries and all the partners working together in order to develop a common vision in terms of financing, in terms of collection of data, of use of the resources, etc. This is very important. Another important aspect connected with these registries is that we realized is that we have 1 million households that are contained in our database. In terms of variables, we have at least 1 billion variables that are collected in these databases. In this decree, we defined the mandatoriness of the security questions. We work on what we call this type of IT system. We have a digital system. We have worked for demographic targeting, and also with the agency that is responsible for personal data in order to develop security aspects. Another important aspect is the specificity of targets, because we handle data of a population that is already very vulnerable. We have many poor, vulnerable people in our population, and we have to strengthen, to increase the precautions in order for this data to be abused. What we need to do, we have to improve our information system. There are some information that have to be improved. We have to reinforce security and also the protection of all the data and these databases in general. This decree has further strengthened the protection systems that we have, also for the allocation of resources. And this is a very precise system in which the energy comes from outside. We have privileged partners such as the World Bank that helps us with our resources, but it is very important in terms of security. It is very important that the state is providing resources to finance this sector. This is also very important from the point of view of sovereignty. We also worked on a system, a long-term system that allows us to consolidate all our key, all the logistic, technical, and technological systems that are necessary for our registries, so that we can further progress. We have different systems for shock responses. There are many demands on the power on the part of our people. So we need to collect this data. We have many things that we still have to do. And I think that this is an occasion to make an appeal for our partners so that they further invest in this registry, which is going to make it possible to have profits for all for us in terms of efficacy of accuracy in interventions and of targeting. This is very important from all this point of view, also from the medical point of view, and also from the point of view of anticipation of crisis, of prevention of crisis. I think that we are in the right direction to do that.
Thank you. Thank you very much, Dr. Diop, also for bringing in your medical experience, formidable medical experience. The time has been passing, so this will be my last question, and this will go to Deputy Director Pabón. And as I already said, it will be on social registries. And my question is as follows. So we do have countries, we Dr. Diop mentioned the World Bank, and I'm very grateful for that as being a World Banker. And we do work with countries that actually do have registries, but we call them static registries, meaning you have a certain database. There was a census swap several years ago. People are in this base there, available. The info is there, but there is no dynamism. There is no way to enroll new people and disenroll people who don't need it anymore. And Colombia is making a move from those periodic survey sweeps I just referred to a more dynamic system. And could you tell us, Director Pabón, how is this working and what actually prompted, what facilitated and what hindered that very important effort to dynamize social registry? Please.
Yes, thank you. So yes, the information of CISBEN, it's updated through census sweeps. And this is something that we do it in close coordination with the municipality, with the local authorities. So to implement CISBEN-4, a national survey sweep was required, since we identified that almost, as Michal was saying, that almost 75% of the information from CISBEN-3 had not been updated since 2011. So the data collection process to update the information for CISBEN-4 through census sweeps started in 2017 and finalized in 2020. So it took us almost 4 years to update information. So survey sweeps require a strong commitment and resources from the national and also from the local and subnational authorities. They are costly, they are very demanding in terms of administrative and operational processes. So on CISBEN-4, households information can be updated by using administrative records and based on household self-reports. And for the first one, the idea is that we use administrative data, updated information that we have from some other sectors, data on education, data on health, data on labor market, on housing, to update the information that we have on the households that are in CISBEN-4. And for that, the interoperability of CISBEN-4 with the administrative data, it's necessary. And the other alternative is to update information is through household search reports. And to do this, we are exploring some alternative with some social programs so they can think of some incentive for people to keep the information updated. We have also recently launched a virtual office of CISBEN. We call it Portal Ciudadano, portal for citizens, which allowed us or allows citizens to carry out some procedures related to CISBEN without having to reach out the municipal office. And what we're doing is basically removing some operational barriers so households can update information in an easy way. It is also important to mention that our National Development Plan had established the creation of a social registry of households to have updated information on the socioeconomic situation of individuals and households and to monitor the different benefits that are received by the citizens. After that, and during the pandemic, the Law 812 of 2020 formally created the social register administered by the National Planning Department, and it also included new provisions for the sharing of information. The fact that the social registry of households has been included in the development, our National Development Plan, has facilitated his prioritization as a key instrument to improve the targeting of programs and the unification of information, especially for cash transfer programs. So our social registry integrates information from programs and subsidies with demand-side data, socioeconomic information from CISBEN to become an instrument with more and better information that facilitates the identification of households whose income has been affected and who have not been linked to social programs. Our social registry will also allow us to monitor some changes in socioeconomic condition of households in order to identify those households that require the support for social programs to improve their situation. So right now, the social registry of household has information from CISBEN. We have information also from health, information from education, from basic education and higher education, information from some cash transfer programs, information also from victims of the conflict. So we have some data, some information, but we must say that we are still struggling to get access to some information, especially on contributory pension, contributory health. And on the question also, we believe that the pandemic was an opportunity to accelerate the digital transformation in the government. The pandemic also showed us the importance and the urgency of having a more effective interoperability data sharing process, so the targeting of social programs can be improved and we can reach out the poor households that haven't been covered by some benefits or programs and that they need. I will also say that some legal and technological aspects related to the exchange of administrative information has also hindered the interoperability process and the consolidation of the social register. Since we are exchanging households' confidential information, even within the government, we have some legal requirements for the sharing of the data. But we're working on addressing these problems. For us, the next step right now is to consolidate, to finalize the integration of the data, to get access to the more important data, and to consolidate the use of the social registry so we have more dynamic information to better inform the targeting of the social programs.
Thank you very much, Dr. Pabón. Really, every adversity is an opportunity. You described so well how you use the pandemic challenge to strengthen the systems. Our time has come to an end, and I would like to finish on two reflections. The first reflection refers back to the famous conditions for perfect targeting, which one of the friends of mine once said that I always liked it, but repeated too often. So he said, and he's a very good economist, he said that perfect targeting is possible under three conditions, which is that all red-haired people are poor, only red-haired people are poor, and there is no hair dyeing technology. Otherwise, we will always have problems. But the book on revised targeting methods and the discussion today actually gives me much more optimism than that statement about red-haired people, that even in absence of those conditions, we can do a good job. Governments can do a good job when it comes to targeting. That's an overwhelming conclusion, both from the book and from the discussion today. And thank you for that. And let me also say that the discussion today needed when it was prepared by so many people who I will thank in a moment, some principles or some issues that are relevant for targeting were also used for preparation of this event. First, we needed to do targeting, and we targeted the best possible speakers, Dr. Hanna, Dr. Diop, Director Pabón. We needed to use technology, like in targeting. The Zoom was selected. Maybe we could do better, maybe not. We'll see, but the technological choice was non-trivial. We needed to contain costs. We didn't have an unlimited budget. Like in targeting, costs were of important consideration. And also, we believe that we have a dynamic process. So if a few years down the line, you want to be invited again to a targeting event, please work on those issues, because our registry is dynamic and we will be inviting those people who will remain on a cutting edge, like you were on a cutting edge today, very, very clearly. So I would like to thank very much first the authors of the book. Second, all the panelists who I already mentioned today, but then there is these people I cannot mention who played a major role behind the scenes in preparation of this event, in ensuring interpretation, in ensuring that everything goes smoothly, on time, and in a proper sequence. So thank you all. Have a good rest of the day wherever you are, and it is very much appreciated that you decided to spend almost an hour and a half of your time with us on the topic of paramount importance for development and for social protection. Thank you, and have a good rest of the day again. Bye.